Stretching is great for all sports, but today we're going to focus a little bit on running. So for running, I do recommend something called dynamic stretching prior to exercise or prior to your run, and then static stretching, which would come after your run when your muscles are still warm. Dynamic stretching has a lot of value prior to exercise and prior to running, and this is because it stretches your muscles out. It gets you prepared to actually do something that's a little bit harder, more active, such as running. The squat jump is a great dynamic stretch. You can stand with your feet pointed straight ahead of you, shoulder width apart, and then you're going to draw your navel and contract your glutes as you descend into a squat position. You're going to jump up, raise your arms over your head, and land softly. Hold the landing positions for about 3 seconds, and then you want to repeat this for about 5 to 8 reps. Front leg swings, or also known as pendulums, you want to stand on one leg. You want to bend your knee, and then you want to swing the leg that's not on the ground behind the body and bring it back to the center of your body. And then you want to swing this leg in front of the body and bring it back to the center. You can repeat this 10 times. Hip raises are a dynamic exercise. You want to lie on your back, knees bent, and your feet flat on the floor. You want to brace your core, squeeze your glutes, and raise your hips so your body forms a straight line from your shoulders to your knees. Pause for 3 to 5 seconds, squeezing your glutes tightly the entire time, then lower back to the start. Do about 10 to 15 reps. The value of static stretching after running is to stretch out your muscles, and this prevents injuries such as tendinopathy that can lead to injury in the future. The butterfly or groin stretch is a static stretch that will be done after you run. Bend your knees and place the soles of your feet together while you're sitting on the ground. You want to gently apply pressure to the insides of your knees until you feel a slight stretch in your groin or inner thigh. Holding this for 20 seconds is the most beneficial. The iliotibial band glute stretch laying down is a static stretch. You want to start by laying flat on your back and bending both of your knees forward. Cross one leg over the other so that your foot is on the opposite knee. Bring both of your knees towards your chest and gently pull the uncrossed leg towards you until you feel a stretch in your buttocks. Hold this position for 30 seconds and repeat 3 times. When you've completed this, move on to your other leg and repeat that 3 times. The hamstring stretch is a static stretch. You want to lie on your back. Raise your left leg as high as you can, keeping your pelvis flat on the ground. Hold your lower thigh and encourage the leg to move towards your head. Flex your foot to stretch your calf as well. To deepen this stretch, you can also place a band or a yoga strap or even a towel on the ball of your foot and use your hands to pull the strap towards you. You want to hold this for 30 seconds and then switch legs. The quad stretch laying down is a static stretch. You want to lie down with your face facing the ground. Ensure that your legs are on the ground and are parallel to each other. Now grab the right foot using the right hand so that your thighs remain lined up close to each other. Inhale deeply and remain in the posture for 30 seconds, and then switch legs. The quad stretch can be modified into a standing stretch. Stand on one leg with your knees touching. If you need to grab or hold onto a chair or wall for support, you can do so. Grab your left foot with your left hand. Do your best to keep your chest upright and don't worry about how close your foot is to your backside. Keep your focus on getting a good stretch in your quad. Hold for 20 to 30 seconds, then stretch the other leg. Regardless of your expertise with stretching or running, I do always recommend that you consult with your physician before beginning an exercise or stretching regimen.